So I had this patient, right? And this patient had a bunch of neck pain. All over, in fact. Not just on the one side, all over. But when the neck was fully investigated, it was found that the cervical spine, tissues all around it, were actually moving well. Not too rigid, not too spasming. Irritated, perhaps, but overall doing pretty good. When we investigated lower, on the other hand, in that T3 to 5 area, turns out there was a significant left side bend, a bend to the side. And so that means that the tissues are short on the left, quite rigid, long on the right. That's not what we're too concerned about now. We're concerned about the reaction to the problem, because oftentimes that's more interesting than the problem itself. So this particular person had been told that they need to stretch their neck out, and it's not a bad idea. In fact, it can be very helpful in some cases if done well. They've been told to stretch their neck all over and use quite a bit of force. And that's where this can be a problem. They had been told, in fact, put your head to one side and then put a hand on that head and push, force, make it go. And that was probably not what was actually said. Probably. That's probably how the patient took it, though. And this often happens. Let's go for it. More is better. And this is just not the case, especially when it comes to human tissue. We have to do what it wants at that particular time. But you have to understand this tissue is in fact stronger than steel in some ways, and we can take that literally in many cases, but this shortened tissue through this area especially, because it has had time to thicken, and on a technical term, fibrose, it has become more rigid than other areas of the body. The fact is, and this is very unlikely that this would ever happen, but the fact is, because of this thickened tissue, it is somewhat more likely that if we really forced through this area, we really gave it a good try to open it up, if we actually knew where it was, you might instead break the bone first, or tear the ligament, tear a tendon, something else, before you would actually get that tissue to release and unwind. All at once, anyways. That's a very bad way to do that. Try to get that tissue to release all at once. So you need to dose that out effectively. This is very much the truth. In any case, what usually happens, that didn't happen. We didn't break anything. Nobody broke anything. I certainly didn't break anything. But what usually happens is we initiate a guarding reflex. Now, what this is in the first place is a contracting tissue. There was some nerves going to this at some point, probably, that told it, hey, you need to really start firing off. You need to start sending off muscle contraction signals. Let's go to it. Let's lock this thing down. So it stopped moving at one point from this same guarding reflex for whatever reason. And that means it will resist lengthening. So if we went in there and we tried to pull it apart when it's still capable of active contraction, in fact, the nerve signals will pulse out harder. We'll get harder nerve signals. And this is from, as we know, the muscle spindle. And so it will not allow movement into this area. And gradually over time, it becomes thicker and thicker and allows for even less and less movement, to the point where it's quite dormant in a way. It's not moving much at all. And though it can be reduced, it's very hard to do so now. Or at the very least, it's harder to do so. So when we go in there, in a lot of ways, when we go in there with a big force, we attempt to really move this tissue with a forceful stretch, and we make a big effort. We push really, really hard. What you're also going to find is that this now moves in chunks, because it's as if, even if it's just on the one side, the shortened tissues, it never is, but even if it was just on the one side, the section would be as if it were fused together, as if it were all wired up. And so that means whether it's actively guarding or now passively resistive to motion, when we go and we bring in that big stretch into that region, we bring the cervical spine this way and we attempt to reverse it, changing side bending, it will skip this area entirely. It will stay in the same place And all we're going to end up doing, more than likely, is just hyperextending the area above and the area below it. Even though we were intending the right thing, even though we were trying to get it to move, and somehow we knew the exact right angle, if we use too much force, too much pressure, we end up doing the exact opposite and potentially adding more irritation to the system, potentially kicking up that guarding reflex. So what should be done is a question. And there's a lot of answers to that. Of course, there's a reason why manual therapists, like osteopaths, like fascial stretch therapists, like chiropractors and physiotherapists, there's a reason they have a job. And their job is to go down and break that up. But if you wanted to do that effectively, whether you were stretching or you were a practitioner attempting to help someone, many times the trick is to work on the edges that will give you motion. So even though you want to get in there and you want to just hammer away on that because more is better, and even though that's not true, and you know that's not true, you get fed up sometimes, and that's what you want to do. But the best thing in many cases is to work just barely into the edge of what will move. That's usually right at the top and the bottom of the major problem. And as you get in there, as you gradually start moving in, this can take sometimes weeks, sometimes months. You open it up, whether you're stretching it yourself or someone else is stretching it for you. Gradually move and move and move just around the edge and the allowable movement. Something that will give you anything at all until it starts to dissolve as a natural process, because that's what it's for. So sometimes you got to do it slow and gentle, and most of the time it will take a while. So best of luck to you in whatever way you choose to do that.